All right, let's move on to case number 2. You're gonna eat lightning. This case was submitted by Katherine Guess. She's a Pediatric Emergency Medicine Fellow from Baylor College of Medicine and Texas Children's Hospital in Houston. Kiyetta Alade helped out with the case. This is a healthy 5-year-old boy who presents with 2 days of mid-sternal chest pain after he was struck in the chest by the handle of a seesaw 3 days ago. There was no pain initially, but the parents sought care at an urgent care the next day when he developed some pain. And at that urgent care, they got a chest x-ray. Here is the AP view of the chest x-ray from urgent care. And here is the lateral view of that same chest x-ray. Even though he was in pain, the urgent care teetered and tottered about the diagnosis and ultimately said that he had costochondritis and sent him home with a recommendation for scheduled ibuprofen. The pain did not improve, and he was seen in the primary care office the next day with worsening pain, especially on deep inspiration. In the office, he had a breath-holding spell, which one does, secondary to pain, and he recovered from it, but they called EMS and he was transported to the emergency department. In the ED, his vital signs, heart and lung exam were normal. He did have pain with palpation overlying the swollen, but not bruised, area immediately inferior to his manubrium. The team got specific sternal x-rays, and here's what they showed. You can take a look at an oblique and a lateral view. So, once again, you'll have 30 seconds. What is the diagnosis? Is it A, costochondritis, like the urgent care said? B, a sternal dislocation? C, TC syndrome? D, slipping rib syndrome? Or E, pneumomediastinum? The correct answer is B, sternal dislocation. The sternal radiographs, especially that lateral, demonstrated dislocation and 56-degree posterior rotation of the first segment of the sternum inferior to the manubrium. You can see it outlined here in yellow. In children, the sternum has multiple parts, including the manubrium, the four sternabrae, the xiphoid process, and it's all connected by cartilage. Fusion starts at age 7, but it's not complete until it gets 25. And the pliable sternum is actually rarely injured. Frankly, I've never seen one of these until this case was submitted. So most cases of sternal dislocation are caused by a direct or indirect traumatic force to the sternal wall. Osteonecrosis and avascular necrosis can set this up also. Patients present with chest pain worsened by deep breathing, cough, or Valsalva, and the first sternal segment, like in this patient, is the most likely to become dislocated, and it can rotate up to 90 degrees. Interestingly, intrathoracic injury in conjunction with sternal dislocation has not yet been reported in the literature. Diagnosis is made by chest x-ray with CT confirmation, but ultrasound, based on limited reports, can be sensitive and specific. Management is observation or surgical, and cases that are not operative, well, they remodel over a couple years. TC syndrome is idiopathic localized swelling of the costosternal, sternoclavicular, or costochondral joints of the second or third ribs. That's not where his pain was. Slipping rib syndrome develops when ribs 8 to 10 lose their cartilaginous connection, causing subluxation, impingement of the intercostal nerves, and pain. Pneumomediastinum can be a consequence of chest trauma, but it's generally apparent on chest x-ray. And costochondritis was his initial diagnosis, and the x-ray from urgent care did look normal, but sternal dislocations need dedicated sternal films to assess, and his swelling did progress over the involved segment and rotated more over the next day. So they admitted him to the hospital for pain control, and he went home the next day. On a follow-up x-ray that was 10 days later, he had increased rotation, but was doing better. So you can see on the lateral there that it's more rotated. So this evolving rotation has been reported in the literature, and However, the patient still is doing well and he's just being followed by serial x-rays.